There have been reports about a patient that appears to have been cured of HIV. I can describe what's gone on with this London patient based on what has been reported in the media. According to the news reports, this patient had been diagnosed with HIV, and it sounds like he wasn't initially on treatment but developed Hodgkin's lymphoma, which is something that happens to some people with HIV. And as part of his treatment, he needed a bone marrow transplant. And they did a version of the bone marrow transplant very similar to what they did with a patient called the Berlin patient, who got a bone marrow transplant with a modified form of a receptor on his CD4 cells, which are the target cells for HIV. It's called the CCR5 mutation. And that mutation allows the patient to be protected from HIV. They don't naturally get that reinfection after the transplant because their immune system cells have been replaced with this mutated cell. So normally in HIV infection, many people will have infection because of the CCR5 receptor on their CD4 cells. If they can mutate that receptor, the HIV isn't able to bind and infect the patient. There are some types of HIV infection that don't use that receptor, so this isn't a cure for everyone with HIV. And I would say it's not a cure for very many people with HIV. They tried this in other patients, and it hasn't been successful. It's been successful with one other patient who has been HIV-free for many years now, not taking any HIV medications. But for most patients, this would not be an option because the drugs we have are so well tolerated. Patients really do put themselves at risk when they have to get a bone marrow transplant because it does require them to get extensive chemotherapy and sometimes radiation therapy. But I'm very optimistic because we haven't ever been able to cure people before. And if this is really a cure of 2 patients, maybe we'll learn something that will give us more information that we can use in the future.